Hello everyone, I am Dr. Samantha Sathyakumar. I am a consultant endocrinologist practicing at Apollo Hospitals, Jubilee Hills, Hyderabad. So for the next couple of minutes, I will be talking about hypoglycemia in diabetic patients. So hypoglycemia is basically low blood sugar level in the blood. Hypoglycemia can happen in diabetic patients who are on insulin or in patients with diabetes who are taking certain groups of oral diabetes medications. So low blood sugar commonly happens for a list of 2 or 3 reasons. So one is if the patient is taking a higher dose of insulin or oral medications and is eating relatively less food, if the person has delayed their meals, if the person has probably exercised more, if the patient has had a lot of drinks, or if the patient is then acutely or suddenly ill on that particular day with something else like maybe a stomach upset, vomiting, loose motion, fever, things like that. So what are the symptoms of hypoglycemia or low blood sugar, and why is it important to identify and treat them early? So early symptoms of low blood sugar can be things like shivering, feeling the sensation of having a very fast heartbeat, sweating, feeling very cold, uh, feeling anxious, angry, irritable, feeling forgetful. So it is important for the patient and their relatives to identify things at this stage so that it can be treated. Unidentified and untreated low blood sugar can then progress to things like having difficulty seeing, difficulty walking, and can even progress to unconsciousness or seizures. So what do you do when you identify low blood sugars? If possible, check the blood sugar of the patient with a glucometer. So if it is less than 70, it would be hypoglycemia. So if it is low, or if you suspect it's low and you don't have a glucometer, it is good to treat the patient with about 15 grams of quick acting carbohydrate. So what is quick acting carbohydrate? The best would be maybe 3 spoons of sugar water or 3 spoons of glucose dissolved in water, or maybe a glass of some very sugary drink like maza. So chocolate is not a very good idea because the glucose in that would take time to be absorbed. So once you give quick acting glucose, we'll wait for about 15 minutes for the patient to recover, and if they've recovered, then we will check their blood sugar again, make sure it's come to normal levels, and then give them a substantial meal which will then sustain them for a bit longer. So maybe once they've recovered, you can give something like roti, bread, chapati, idli, dosa, banana, any of those things you can give. So it is important to learn to identify these symptoms, because more severe symptoms can be a really terrifying experience for the patient, which is one of the major causes for poor treatment outcomes in diabetes. So always watch out for hypoglycemia, identify and treat it correctly.